Welcome back to the deep dive. Great to have you with us again as we keep digging into the source material you've brought us.
Absolutely. And today we're focusing on something really fundamental, health and human services in Eritrea. And just to be clear, this is based strictly on the text provided.
That's right. And it's important to note this is actually part 6 of a 7-part deep dive. We've been looking at different aspects of Eritrea through this specific source. So if you've been with us, welcome back.
hmm
If you're just tuning in, you might really want to consider going back to the first 5 parts. They lay a lot of groundwork for the context here.
Definitely helpful context. So yeah, looking at the text, our mission today is pretty clear.
Mm-hmm.
Let's unpack the key details the source gives us on healthcare, labor, and human welfare efforts, sticking only to what's in this document.
Okay, let's do it. Starting with healthcare, what picture does the source paint right at liberation back in 1991?
Well, the source describes it pretty starkly. It says the system was in ruins
Hmm.
because of colonization. And this wasn't just, a few old buildings. It was systemic.
Systemic how?
Lack of physical facilities, definitely. A severe shortage of trained staff. Resources weren't distributed well. And even basic supplies, like essential drugs, were lacking. It
Yeah.
was.
Hmm.
Yeah, in ruins seems accurate based on the description.
So starting from, well, almost nothing in some ways, but the source then points to some really significant efforts, achievements even in the years after that, right? Say between 91 and about 2007.
It does. And it specifically notes this progress happened despite some major challenges of the war from 98 to 2000, and then that long no peace, no war situation afterwards.
So what kind of efforts are we talking about? Infrastructure?
Oh yeah, big time on infrastructure, according to the source. It details the construction of 13 new hospitals, 19 new health centers, and get this, 112 new health stations.
Wow, those are big numbers. Can you put that in perspective, like percentage increases?
Sure. The source calculates it as a 56% increase in hospitals, 61% in health centers, and a massive 156% increase in health stations.
156%.
Yeah. And another point the source makes, virtually 100% of the health centers operating at the time of the report were apparently built after liberation.
So that whole tier of the system was basically brand new.
Seems like it, based on this text.
What about the cost? Does the source mention the level of investment involved?
It gives one specific example, the construction of key referral hospitals. That include the main national one, Arata Surgical Medical National Referral Hospital, plus 4 zonal ones. The text puts the cost for just those at around $500 million nakfa.
$500 million. Any idea what that translates to?
The source actually provides a conversion, roughly $33 million US dollars for those specific hospitals. So yeah, significant investment described there.
And the source also cautions against just looking at the number of new facilities, right? It's something about replacing older ones.
Exactly. It makes the point that some new hospitals actually replaced older ones to improve the quality of care and expand what they could do. So the numbers, the percentage increases, might even underestimate the total effort involved in building, expanding, and upgrading.
Right, makes sense.
And to really drive that home, the source states explicitly that more health facilities were built in those first 15 years after liberation than in the entire century before that.
A whole century.
Yeah, over a 100% increase in total facilities described since 1991. But of course, as the source itself acknowledges, building is one thing.
Staffing them, funding them, equipping them. That's the next challenge.
Precisely.
So how does the source say they tackled the people part, the human resources?
It details some pretty impressive training efforts. In those same 15 years, the schools under the College of Nursing and Health Technology reportedly trained close to 3,000 health professionals.
3,000. And did that make a dent in the ratios? Doctor to population, nurse to population?
It did, according to the numbers in the source. The doctor-to-population ratio improved by over 100%, from 1 per 37,500 people in 91 to 1 per 15,000 by the report's time.
Okay, big jump.
Same for nurses, also more than doubled, went from 1 per 9,500 to 1 per 3,400. And interestingly, the source notes that even with all the new facilities and higher demand, the ratio of health professionals to facilities was maintained or even improved since 1998.
That's quite a feat, keeping pace like that. What about higher medical education? Did the source mention anything there?
Yeah, it mentions the Ministry of Health was actually setting up a full health university. The idea, it seems, was to bring together existing places like the Arata School of Medicine and other colleges.
To offer degrees locally.
Right. MDs, nursing, pharmacy, the work's all based in Eritrea according to the plan described.
And the Arata School of Medicine itself.
The source highlights its growth. It apparently started quite small, February 2004, with just 32 students. But within about 3 years, the intake had grown 5 times to 150 students.
Wow, a five-fold increase in intake pretty quickly. Shows a real push.
Seems like it, yeah. A rapid effort to scale up domestic training based on the text.
Okay, so you've got more buildings, more staff. What about the actual medicines and supplies?
The source points to a consistent effort there, too, improving availability and access to essential drugs. It cites surveys showing availability stayed above 90% nationwide for a whole decade, basically 1995 to 2005.
Over 90%, that's consistently high.
So you put all that together, more and better facilities, more trained staff, reliable drug supply, and the outcome described by the source is naturally better access for people.
How much better?
The text reports access within 10 kilometers improved from about 40% at liberation to around 70% by the time of the report. And it adds that over half the population lived within 5 kilometers of a health facility.
That's a fundamental shift, isn't it? Bringing care much closer for potentially millions.
It certainly sounds like a major change based on these figures.
Okay, let's shift to public health successes. The source uses some strong language here, doesn't it? Calling the achievements in controlling certain diseases exemplary even worldwide.
It does, yeah. That's a pretty bold claim. It specifically mentions vaccine-preventable diseases, malaria, and HIV/AIDS.
So what evidence does the source offer for that exemplary description? Let's start with immunization.
Okay, well, it notes coverage was really low back in 91, like 10% for DPT-3, even though the program existed before then. But it reports a huge jump to over 85% coverage for both DPT-3 and measles by the time of the report.
And the results?
Tangible ones, according to the source. Elimination of neonatal tetanus and measles. And no polio reported since 1997, apart from one imported case in 2005 that was contained. The source credits a strong immunization program for this.
Right. What about malaria? That's often a huge burden.
Another major success detailed in the text. It reports a really remarkable 90% reduction in overall malaria illness between 1999 and 2006.
90% reduction. How?
The source lists a whole combination of things. Widespread use of insecticide-treated bed nets, or ITNs, programs to retreat the nets, killing larvae, reducing breeding sites.
The vector control.
Yeah, plus early detection and treatment of cases, public awareness campaigns, and making sure effective drugs were available. It sounds like a really comprehensive, multi-layered strategy described in the source.
Okay. And HIV/AIDS.
The source suggests infection rates were stabilized at a relatively low level in the general population. It gives a 2005 estimate of 2.46% prevalence. Though it does add an important caveat that figure might be a slight overestimate because rural populations might have been underrepresented in the data they used. The data came from pregnant women, blood donors, and people using voluntary counseling and testing services.
I see. Important context. Now, maternal and child health, always a critical area. What does the source cover?
Interested extensively. Antenatal care, or ANC visits for pregnant women, saw a huge increase. The source says only 19% got at least one visit in 1991. By the time of the report, that was up to around 80%.
Wow, from 19% to 80%.
A 400% increase in coverage, as the source calculates it.
But then on skilled birth attendants, having a trained person present at delivery, the picture is a bit different, isn't it?
It is. That also increased a lot, from just 6% in 1991 up to 37%, so a 600% increase. But interestingly, the source itself describes this progress as slow.
Slow. Despite a 600% increase, that's an interesting way to frame it. Maybe the target was much higher.
Could be. It does make you wonder about the benchmark they were using or how success was being perceived in the source. But on the flip side, emergency obstetric care handling complications during childbirth showed rapid improvement.
I hope so.
And what the source calls met need. That apparently went from just 12% in 1998 up to 65%. The text links this to better training, things like life-saving skills, emergency surgery, suggesting improvements in both the quality of care and maybe people being more likely to seek that care when needed.
And that's crucial for saving mothers' lives, right?
Absolutely vital for reducing maternal mortality.
So all these different health improvements described, did they translate into lower death rates overall and longer lives?
Yes, the source presents some pretty compelling numbers on that front. Infant mortality reportedly dropped significantly from 72 per 1,000 live births in 1995 down to 48 in 2002.
Okay. And for older children?
Under 5 mortality also fell, from 136 down to 93 in that same period.
What about maternal deaths?
The maternal mortality ratio, the MMR, was estimated at 752 per 100,000 live births for 2002-2003. The source points out this is 25% lower than the estimate from 1995.
Significant drop. And overall death rates, life expectancy.
The crew death rate also decreased substantially. And maybe most importantly, life expectancy at birth saw a big jump from 49 years in 1991 up to 59 years by 2003, according to the source.
And a 10-year gain in life expectancy in about 12 years, that's striking. And the source makes a point about comparing this to other places, doesn't it?
It does. It explicitly notes this positive trend happened when many other countries, especially those heavily affected by HIV/AIDS, were seeing life expectancy actually decline. And the source attributes Eritrea's increase partly to those big reductions in deaths from communicable diseases like measles, malaria that we talked about, affecting infants, children, and adults.
Okay, let's shift gears a bit, though still under the umbrella of welfare. The source also discusses the Ministry of Labor and Human Welfare. What's its main goal, according to the text?
Its aim, as stated in the source, is ensuring social justice and social equity for all citizens.
Sounds broad. What kind of responsibilities does that cover?
It's a really wide range described in the text, handling employment services, labor relations, workplace safety, setting up Social Security, community development projects, rehabilitation services, childcare, family welfare, a whole lot.
Okay, let's break that down. What does the source say about employment services?
It mentions employment exchange services operating in different regions and cities, and it gives some stats. About 193,000 job seekers registered over time, and roughly 78,000 were placed in jobs.
Any sense of the placement rate?
Yeah. The source calculates an average annual placement rate of about 41%. It also mentions a program allowing citizens to work abroad. Over 11,000 did so, apparently as a way to ease unemployment.
And the flip side, foreign workers coming in.
Yes, the source notes work permits were issued for foreign workers, over 14,000 permits, specifically to fill skill gaps within Eritrea.
Okay. What about protecting workers already in jobs? Labor inspection.
Highlighted as well. The source says its purpose is worker safety, health, and making sure minimum conditions are met. It reports over 8,000 inspections of workplaces since 1998.
Any specific areas they looked into?
Yeah, it mentions specific studies on things like industrial hygiene and safety in textile, tannery, and plastic shoe factories.
Now, Social Security, that's a big one. When did that start, according to the source?
A scheme was introduced in 2003, the text says. It included a national pension, a public sector pension, and also, significantly, a martyr survivors benefit scheme.
Who was eligible?
Initially, civil service employees aged 18 to 65. The source estimates there were maybe 70,000 to 80,000 potential contributors in the civil service.
And how many had joined by the time of the report?
Over 22,500 were registered for the new pension scheme, excluding military personnel. So it looks like the initial phase of rolling out that safety net.
The ministry's name includes human welfare. How does the source describe care for vulnerable groups, starting with children?
Children are definitely emphasized as a major concern. The source highlights Eritrea signing and ratifying the UN Convention on the Rights of the Child, the CRC, back in 1994. And it makes a point of noting the CRC was translated into 6 local languages, which suggests an effort to make those rights widely known. Specific problems tackled include orphans, street children, exploitation, and children with disabilities.
And the border war must have had a huge impact on kids.
A devastating impact, detailed in the source. Just in the southern region, over 24,000 children were identified as displaced by the war. The text describes concrete support provided.
Like what?
Like a canteen center, set up in Senefi, just for over 1,700 unaccompanied children, providing tens of thousands of items of personal effects, clothes, bedding, etc., even putting generators and audiovisual gear in temporary camps to help with education and just keeping kids occupied.
Wow, practical support. What about persons with disabilities?
Another key group. The source says the goal of rehabilitation is self-support if possible, or long-term security if not. This covers civilians, veterans, victims of accidents, disease, landmines.
Any specific programs mentioned?
It talks about a planned, community-based rehabilitation program aiming for wide coverage, 43 subregions, hoping to reach 80% of the target population.
And practical help, like wheelchairs or prosthetics?
Yes, the source gives a number. Over 22,500 people with disabilities received various assistive devices like those since independence. It also specifically discusses reintegrating war-disabled combatants.
How are they supported?
About 2,000 from a center called My Habar received economic and psychosocial support to help them transition back to civilian life. There's also mention of ongoing financial and medical aid for thousands of war-disabled veterans, including severely disabled ones at a place called Dendon Camp.
Housing, too.
Yeah, 500 houses were built for war-disabled veterans at a stated cost of 365 million nakfa. And the source adds there was support for associations representing groups like the blind, the deaf, and war-disabled combatants themselves.
Okay. What about support for the elderly?
The source estimates elders make up about 4% of the population. It notes traditional family care is the norm, but the social protection program also steps in.
How so?
It states about 40% of the program's beneficiaries are older people. This includes support through that Martyrs Survivors Benefit Scheme we mentioned, and also income generation projects specifically for elders who are caring for orphans. Some efforts for reintegrating disadvantaged elders, too.
Finally, under this welfare umbrella, what about needy families in general?
The source highlights two groups specifically: martyrs' families and families affected by HIV/AIDS. It gives context on the human cost. Around 84,000 citizens lost their lives.
That's a huge number. How are their families supported?
The source details significant annual financial support going to martyrs' families since 1994. It mentions around 62,000 families, covering over 100,000 individual beneficiaries, receiving hundreds of millions of nakfa each year.
Wow. And families affected by HIV/AIDS.
Support described there, too. About 4,000 people in affected families receive monthly financial help for things like kids' schooling and household needs. Plus, the text says over 1,300 of these families got grants to start small businesses, income-generating activities.
Helping them become self-sufficient.
Seems to be the goal, yeah. And lastly, under community development, the source briefly mentions community centers, skill training for disadvantaged women, preschool for disadvantaged kids, and quite a bit of HIV/AIDS awareness training for community leaders across the country.
Okay, so stepping back and looking at the whole picture presented in the source, we've covered the description of a healthcare system rebuilt almost from scratch, the public health achievements the source calls exemplary, and then this really broad range of labor and human welfare initiatives.
Yeah, aiming to build that social safety net, tackling employment, Social Security, but also providing very targeted support for specific vulnerable groups like children, people with disabilities, elders, martyrs' families, and fostering community development overall. It's quite a comprehensive picture painted by the source.
It really is a detailed account of the efforts described in health and human services since independence. And just a reminder for everyone listening, this was part 6 of our 7-part deep dive into Eritrea, all based on this specific source material.
That's right.
If you missed the earlier parts, seriously, consider going back. They provide a lot of the surrounding context for what we discussed today.
Indeed. And we do have just one more part left in this series coming your way soon, where we'll wrap up this exploration of the source document you shared.
So maybe something to think about until then, based on today's discussion. Consider the sheer scale of the challenges the source describes back in 1991 needing to rebuild entire systems, and then weigh that against the detailed progress reported in the text, apparently achieved despite those difficult circumstances like war and instability that were also mentioned. What might this effort and the sort of integrated approach to health and welfare described here suggest about the priorities and maybe the resilience reflected in the source's narrative?
Something to ponder.
Mm-hmm.
Until next time.